everyone, welcome to my presentation over the benefits of aquatic therapy. My name is Kyan Wade, and I am currently an occupational therapy doctoral student at the University of Kansas Medical Center. And today we're just going to be talking about the benefits of aquatic therapy. So, as an overview, we're just going to be going over what aquatic therapy is and its history, the common goals of aquatic therapy, usually what's included within aquatic therapy, some different conditions that can benefit from aquatic therapy, overall benefits of aquatic therapy, benefits of aquatic therapy specifically for survivors of stroke, safety considerations for aquatic therapy, how aquatic therapy can impact your mental health, and some research surrounding aquatic therapy. So, what is aquatic therapy? Aquatic therapy is also known as water therapy or hydrotherapy. It involves hands-on therapy techniques that are based on the specific goals of the individual. And usually the individual will work with either an occupational or a physical therapist. And they kind of focus on different aspects when completing aquatic therapy. Occupational therapists will focus on using balance and range of motion and strengthening exercises in order to kind of develop skills needed to perform everyday tasks and occupations. Whereas a physical therapist will focus on increasing flexibility, balance, endurance, and nutrition. And overall, the goal of aquatic therapy is just to help improve your balance, circulation, core stability, endurance, flexibility, motor planning, muscle tone, posture, and strength. So, aquatic therapy has a long-standing history. It dates back as early as 460 BC in Greece, when they used cold water to treat a variety of diseases. And then in the 1700s, cold water was used to treat and comfort individuals with smallpox, and it was also used to reduce fevers. Hot water during this time was used for individuals who experienced muscle spasms. In 1830, Vincent Priscinetti, a Sicilian peasant, combined a variety of vigorous exercises and cold water as a way of strengthening patients who were ill. And eventually, his exercises and practice led to research over the use of water and the interactions with a variety of ailments. So, aquatic therapy has some common goals, such as decreasing pain. And in aquatic therapy, warm water can soothe the muscles and allow them to relax. So, when someone is experiencing muscle pain, they're usually straining to do different activities. The water acts as a massage, and then that creates the muscles or allows the muscles the ability to relax. And typically, this is done through buoyancy. And buoyancy just decreases the force of gravity on your body and it decreases the weight on your joints. And this allows you to be able to move more easily and with maybe less pain. So, another common goal is increasing the healing process and decreasing the recovery time. So, hydrostatic pressure is where the water acts as a force to push back on you. And this causes an increase in blood circulation and a decrease in inflammation. So, if you have a part of your body that is swollen, maybe from, let's say you experienced a fall and you twisted your ankle is swollen, the water would act as a way of allowing blood to circulate through that area and kind of pushing some of that inflammation out and into other parts of the body. That way it like gets out of that area and it allows you to move more easily. So another goal is building strength and endurance. And one way this is done is through viscosity. And this is just a fancy term for the resistance of water. So when you're walking through water, you can walk with the current, you can walk against the current, and depending on like what your goal is and what your abilities are, um, Walking with the water, even though you're walking with it, it's a little bit easier. You're still walking through water, so you're still building those muscles. And then, of course, if you're walking against the water, you're going to realize that's a little bit harder. And it takes a little bit more strength and endurance to do. Um, and really doing it walking in water and using the viscosity and the resistance that water has, it allows you to strengthen your muscles while also focusing on your aerobic capacity and breathing. So another way that you can do this besides the viscosity of water is by using water weights, and those can enhance your muscle strength as well. So another one is improving flexibility, mobility, and increasing range of motion. So in the water, the warmer water promotes muscle relaxation and it increases your circulation. So this will allow you to move easier. When your muscles are relaxed, it's easier to move. And then there's something called buoyancy of water, which decreases the force on your muscles and makes movements easier. So this essentially makes like your movements easier because of the lighter weight that you're experiencing versus on land. Um, so another goal is improving balance and coordination. Over time, your body learns how to respond to the hydrostatic pressure and the movement of the water. And this can improve your things like your reaction time. It can strengthen your muscles. It can increase sensory awareness, and it can also improve your balance. And then lastly, improving your gait. So, as we talked about earlier, buoyancy decreases the weight bearing forces and decreases the amount of pain that individuals may experience while they're trying to walk on land. And this can do as much as just building confidence in the water and making you feel more comfortable while you're walking. It'll keep you from tensing up, it'll keep you just moving and being active and building those gait strengthening skills that you're needed. All right, so what is included within aquatic therapy? So there is typically a warm up, and this could be something as simple as walking laps around the lazy river. And like we talked, you can either walk with the current or against the current. It can be something as simple as stretches, like twisting to your side. It can be slow, controlled high knees or donkey kicks. And then there's usually a fitness and strengthening aspect next. And this is usually done with the water weights or some type of physical movement. So this could be something like flies in the water, rows in the water, punches within the water. And then you typically move into a core training, and you can do planks where you're leaning against the edge of the pool. You can do a one leg stand for balance. And then after you've completed your fitness and strength training and core training, you'll usually do some kind of cool down. Again, this could be walking around the or around the lap of the pool and then deep breathing also. So, there are a variety of conditions that can benefit from aquatic therapy. One of these is arthritis. Another is just individuals who may have balance or coordination difficulties, multiple sclerosis or MS, muscle weakness, neurological injuries, orthopedic injuries, spinal cord injuries, and then individuals who have survived a stroke. So, overall benefits of aquatic therapy are some of the definitions that we talked about earlier. So, I'm just going to run through these really quickly. One of these is buoyancy. And buoyancy serves to decrease the weight bearing that your joints experience. And in turn, this kind of reduces stress on your joints and makes it easier for you to move in the water. Next is viscosity. It provides resistance and strengthens muscles. Hydrostatic pressure decreases joint swelling and improves joint awareness, which As an OT, we call proprioception. It's just being able to know where your limb or where your joint is in space compared to the rest of your body. And then lastly, warm water relaxes your muscles and vasodilates your blood vessels, which makes them bigger and allows the blood to circulate through easier. So, specifically for survivors of stroke, aquatic therapy increases your cardio ability capabilities. It increases your muscle strength and it increases things such as mobility. And this is focused on balance, flexibility, and strength. Some things to keep in mind before signing up for aquatic therapy, there are some safety considerations. Individuals with high or low blood pressure should be aware that aquatic therapy is a form of exercise and it can cause your blood pressure to get higher. So, keeping that in mind, if your blood pressure is already high, it may be unsafe to do aquatic therapy if you are experiencing a high blood pressure day. Individuals who have a fear of water, individuals with incontinence, individuals with open wounds, rashes, or skin infections, and this is just because we don't want them to get infected or infect other individuals. And then individuals with uncontrollable seizures. So, aquatic therapy can impact our mental health. It can relieve stress. It can improve our outlook and confidence. And it can increase our body awareness. And as we talked about earlier, when we're even doing gait training or walking in the water, there's no fear of falling because if you fall, you're falling into the water and there's going to be somebody right there to pull you back up. And usually you're wearing a life jacket or life belt. So it's not like you're going to hurt yourself as much as you would on land. And when you're walking in the water, many individuals feel as though they have more control over their body and they can feel their body moving in the water better than they can on land. So, some research surrounding aquatic therapy. Perez de la Cruz in 2020 found that physical activity performed in aquatics has a positive effect on mood, pain, and quality of life in individuals who have suffered a stroke compared to that of treatment on dry land. And then Zoo in 2016 found that the hydrotherapy increased balance and mobility more than an equivalent amount of land based therapy in individuals after a stroke. Here's a list of my references that I use for this presentation and PowerPoint. And then please let me know if you guys have any questions. Thank you so much.